Lots of big COVID headlines this week. We know you guys have a ton of questions out there, especially with the pause with the Johnson & Johnson vaccine. So let's bring in our expert, Dr. Phil Huang, Director of Dallas County Health and Human Services. Good morning to you. Good to see you. Dr. Huang, I want to ask you first about the number or percentage of vaccinations right now in Dallas County. Where do we stand? I'm wondering if, I know you can hear me. Okay, now we can hear you.
Okay, yeah, sorry, I was on mute.
Do we have him?
Can you hear me?
Gotcha. All right.
Okay.
So explain to us where we stand on the number or percentage of vaccinations right now in Dallas County.
So right now, I think, let's see, for percentage of 16 plus, we're getting close to 50% having received at least one vaccine. For those that are fully vaccinated, it's closer to 24, 25%. So we're making great progress, but there's still a lot more that needs to be done.
How would you say that the pause of Johnson & Johnson's vaccine this week has impacted the work that you're trying to do?
Well, you know, I think we picked right up after we got the announcement on Tuesday morning. We offered Moderna for everyone that was scheduled to come in, and then thawed out some Pfizer and got that on in later the day. So we have Moderna and Pfizer, and as you mentioned, with the rain today, tomorrow we're going to do, if you had an appointment today, I apologize for the rain cancellation, but come in tomorrow. We have Pfizer all day tomorrow, and then Monday's a Moderna day, but we've got plenty of vaccine now for those first doses. And as you said, you can go right online and make your appointment now. You could get online today, make an appointment for tomorrow, or even get on tomorrow and make an appointment for tomorrow.
And Dr. Huang, what's the status with regard to wait lists for vaccines in Dallas County right now? Is there still a wait list?
So that's the thing. We've really gone through the entire wait list. Have at least contacted at least once everyone who was on that was, you know, eliminated the duplicates. If you got on the wait list and for some reason haven't heard anything, then that's, there may have, you know, what we've investigated that sometimes there were errors in email addresses or phone numbers, but please then get back on the online and make your appointment right now. If you haven't gotten your vaccine yet, we can accommodate you immediately.
Could you talk about the prevalence of new strains in Dallas County? You and I have talked about this once before, but I'm wondering if there's any movement in those numbers or new information around that.
You know, we do continue to get reports of those. You know, it's about a little over 50 cases of strains from the UK, New York, and California. But I think the main what that tells us is these strains are circulating in Dallas County, and so we can't let up. I mean, it's again, you know, it's been described as a race, getting everyone vaccinated, as well as we need to continue to wear the mask, to avoid crowds, to still stay 6 foot physically distant, because as I mentioned, you know, it's still a large percentage that haven't received the vaccine yet, and even these variants are circulating, so we can't let up.
Dr. Huang, are people still getting tested? I'm wondering how many, when, and when is it really appropriate to get a COVID test at this point? I know in certain instances you're asked to do that before you travel to certain places, but outside of that, are you guys seeing much in terms of testing?
You know, we still, and there's a lot of places now that offer testing, but the numbers of people getting tested right now have certainly dropped. And I think it indicates, you know, earlier when we saw that drop, it was when our numbers of actual new cases are lower. The vaccines are working. People are continuing to mask, and a lot of businesses are continuing to require that. And so people are still being cautious, and we applaud our community for continuing that vigilance. So the numbers of cases down, the spread's a little lower, but so the number of people getting tested is lower. I think yesterday we had 202 new confirmed cases that were identified and reported. I mean, you remember back, you know, several weeks ago, we were in the thousands of people of new cases. So that's all good news. But again, these variants throw in another variable in this. But, you know, if you develop symptoms that are compatible with COVID, and certainly if you've been exposed to someone who is tested positive, you need to get that test.
All right. Dr. Phil Huang, thank you so much for your time this morning. Good to see you.
Good to see you. Thank you.